The landscape of COVID-19 vaccination in the United States is undergoing a significant transformation. On May 20, 2025, the Trump administration unveiled a new policy altering the approach to seasonal COVID-19 shots. This new directive focuses on specific high-risk groups, primarily seniors age 65 and older. Other high-risk individuals will also be prioritized for these updated vaccines. For healthier, younger populations, availability will depend on more data. The coming months will be crucial in observing the impact of these new guidelines. The Food and Drug Administration, or FDA, is at the forefront of implementing this new vaccine policy, and its updated standards and requirements for vaccine approval are central to the changes. For adults age 65 and older, and for children and younger adults who have at least one recognized high-risk health condition, the FDA will continue to utilize a streamlined approach. This means that updated COVID-19 shots, designed to target newer variants of the virus, can be made available to these vulnerable populations more quickly. However, the regulatory landscape changes dramatically for healthier individuals, specifically those aged from 6 months to 64 years who do not present with underlying high-risk conditions. For this larger segment of the population, the FDA will now mandate a much more rigorous approval process. Companies seeking approval for tweaked or updated vaccines for this group will be required to conduct large, lengthy, randomized controlled trials. These trials must be designed to evaluate clinical outcomes, such as the vaccine's efficacy in preventing severe disease, hospitalization, or death. The guidance itself is currently in draft form, allowing for a period of public comment before the plans are finalized, offering an opportunity for stakeholders to provide input. The new FDA mandate for large, randomized, controlled trials for healthier individuals under 65 is a significant hurdle for vaccine developers. These trials are the gold standard, providing robust evidence of a treatment's efficacy and safety. However, they are time-consuming and expensive. For COVID-19 in healthy, vaccinated younger individuals, demonstrating a benefit from an updated vaccine is challenging. This requires enrolling many participants and following them for an extended period. The focus will be on clinical outcomes, tracking severe manifestations like hospitalization or death. The new Trump administration policy is poised to significantly reshape vaccine availability across different segments of the American population. Estimates suggest that the revised framework could still ensure annual vaccinations are accessible for a substantial number, potentially between 100 million and 200 million people. This group primarily comprises individuals who qualify as high risk, including seniors age 65 and older, and those with specific underlying health conditions that make them more vulnerable to severe COVID-19. For these individuals, the continued streamlined approval process aims to maintain relatively uninterrupted access to updated vaccines as they become available each season. However, the situation becomes more uncertain for healthy individuals under the age of 65. Under the new guidelines, this demographic will not have access to the annual COVID-19 vaccine until more comprehensive data from large, randomized, controlled trials becomes available. This effectively means that for the foreseeable future, younger, healthier people may not be eligible for, or easily able to obtain, the latest iterations of COVID-19 vaccines. Section 5. Expert Perspectives. Voices on the Policy Shift. The new vaccine policy has elicited a range of reactions from health experts, with some prominent figures within the FDA itself championing the changes. FDA Commissioner Dr. Martin Makary and Dr. Vinay Prasad, the FDA's vaccine chief, have been vocal critics of the previous one-size-fits-all approach to COVID-19 vaccination. They have long advocated for more targeted recommendations, emphasizing the need for robust data, especially when considering additional vaccine doses for low-risk individuals. From their perspective, this policy shift represents a move towards a more scientifically sound and nuanced strategy, aligning vaccine recommendations more closely with individual risk profiles and the available evidence. Doctors Makary and Prasad have specifically recommended that pharmaceutical companies conduct studies on individuals not deemed to be at high risk. They suggest these studies should last for at least 6 months, randomly assigning participants to receive either an updated vaccine or a placebo, and then meticulously tracking clinical outcomes. However, Not all expert opinions align with this positive assessment. Dr. Paul Offit, a well-known vaccine expert, has expressed significant concerns about the potential negative consequences of the new policy. He worries that these changes could inadvertently make COVID-19 vaccines less insurable. Section 6. Concerns for the youngest pediatricians weigh in on child vaccinations. The American Academy of Pediatrics, a leading voice in child health, has expressed notable concerns regarding the implications of the Trump administration's new vaccine policy for children. The AAP is worried that this revised approach, which significantly restricts access to updated COVID-19 vaccines for healthier individuals under 65, will unduly limit options for parents and their children. Their primary concern is that the policy could effectively take away the choice for parents to provide their children with the most current vaccine protection against COVID-19, even if those children do not fall into a narrowly defined high-risk category. Unless a child has at least one specified high-risk health condition, they would likely not have access to updated seasonal COVID-19 vaccines until extensive and lengthy clinical trials are completed for their age group. The AAP fears this delay could leave many children less protected, especially as new variants of the virus emerge and circulate within communities. Pediatricians often emphasize the importance of preventive care, and vaccination is a cornerstone of this approach. Section 7. The lingering threat, COVID-19's continued impact by the numbers. Despite the evolving nature of the pandemic and shifts in public perception, COVID-19 continues to exert a significant toll on public health in the United States. Provisional data released by the Centers for Disease Control and Prevention paints a sobering picture of the virus's ongoing impact. Over the past year alone, there have been over 47,000 deaths attributed to COVID-19. This figure, while lower than the devastating peaks seen earlier in the pandemic, still represents a substantial loss of life and underscores that the virus remains a formidable public health challenge. Tragically, these fatalities are not confined to the elderly or those with multiple comorbidities. Section 8. A global lens, comparing U.S. vaccine policy internationally. The Trump administration's new COVID-19 vaccine policy, with its emphasis on targeting seniors and high-risk individuals for annual shots, aligns the United States more closely with the approaches taken by several other developed nations. Many countries have already adopted more stringent or specific rules for COVID-19 booster shots, moving away from broad recommendations for their entire populations. For instance, countries like Australia, Belgium, Canada, Denmark, and Switzerland currently recommend annual COVID-19 shots primarily for individuals aged 65 and older, as well as for other high-risk individuals. This mirrors the core tenet of the new U.S. policy. Similarly, Germany and the Netherlands have set their age thresholds slightly lower, recommending annual shots for those aged 60 and older, in addition to high-risk groups. The United Kingdom has adopted an even more targeted approach for age-based eligibility, recommending annual shots for individuals aged 75 and older, alongside high-risk individuals. This global comparison indicates that the shift in U.S. policy is part of a broader international trend towards more focused COVID-19 vaccination efforts. Section 9. Balancing Act, Potential Ramifications of the New Vaccine Strategy. The Trump administration's new COVID-19 vaccine policy introduces a complex array of potential benefits and drawbacks that will unfold in the coming months and years. One of the primary potential benefits, as articulated by proponents like Drs. Makari and Prasad, is a more scientifically rigorous approach to vaccine approval for healthier, lower-risk populations. Requiring large, randomized, controlled trials to demonstrate clinical efficacy in preventing severe outcomes could lead to a better understanding of who truly benefits most from ongoing booster shots. Another perceived advantage is the alignment with policies in other developed nations, suggesting a move towards an international consensus on managing COVID-19 in its current phase. However, the new policy also carries significant potential drawbacks and raises several concerns. The most immediate is the impact on vaccine availability and equity for healthier individuals under 65, including children. The requirement for lengthy and expensive trials could mean substantial delays in their access to updated vaccines, potentially leaving them less protected against new variants.